Prednisone is an anti-inflammatory steroid that helps to suppress the immune system. It can be taken with food to avoid upset stomach. Consult with your doctor before taking this medication if you are pregnant or breastfeeding. Prednisone can interact with vaccinations and medications such as Advil and Aleve. You should also notify your doctor if you're on warfarin, as this can cause an increase in bleeding. Avoid alcohol while on this medication. This medication may also cause mood swings and blood sugar fluctuations, increased liver enzymes, increased blood pressure, and upset stomach, and should be used cautiously in diabetics, children, and those with hypertension.
Benadryl is a medication that is used to relieve allergic symptoms, such as itchiness, swelling, or hives. It may also be used for trouble falling asleep. Take 1 or 2 tablets for people who are experiencing allergic reactions. Take 2 tablets before you fall asleep for no more than 2 weeks for insomnia. Benadryl may cause significant drowsiness and effects such as dry mouth, constipation, and confusion, especially in the elderly population. Avoid driving and other tasks that ask for you to be alert until you know the full effects this drug has to you. Also avoid drinking alcohol. Benadryl may be taken with or without food. If you experience a GI upset, take with food. Don't give to a child less than 12 years old until you contact your pediatrician.
Azithromycin is an antibiotic used to treat bacterial infections. It does not treat viral infections such as the common cold. The tablets can be taken with food or on an empty stomach. If taken with food, avoid dairy, antacids, or multivitamins. Contact a physician if any signs of an allergic reaction occur, such as shortness of breath, rash, and swelling of mouth and face. Some common side effects include diarrhea, nausea, abdominal pain, or vomiting. Contact your doctor if you continue to experience diarrhea after finishing treatment. Do not skip doses or stop your medicine early, and make sure to take it as directed.
Children's Motrin can be used in children 6 months to 12 years of age to help reduce fever and mild to moderate pain. This medication should be taken by mouth as directed based on the child's weight every 6 to 8 hours. Now, please take a moment to type your child's weight in pounds so an appropriate dose can be provided. Please use the provided dosage cup and do not use a teaspoon or a tablespoon for dosing measurements. Stop the use of this medication and consult a healthcare provider if you see your child's symptoms get worse within the 24 hours. Please shake this medication well before use.
Aspirin is a pain reliever that can also be used to prevent heart attacks, strokes, and inflammation. It is important to note that a daily aspirin regimen for heart health should not be initiated unless you have been directed to do so by your doctor. You should take this medication by mouth with a glass of water. While taking this medication, you may experience some side effects such as upset stomach and heartburn. You should refrain from smoking cigarettes and drinking alcohol to avoid causing further irritation to your stomach. This medication also has the potential to cause bruising and bleeding. If this occurs, you should contact your doctor immediately. Aspirin should never be used in children to treat symptoms of chickenpox or flu.
Plan B one-step or the morning after pill helps prevent pregnancy if taken within 72 hours following unprotected intercourse. However, the sooner it is taken, the more effective it will be. If vomiting occurs within 2 hours of taking this medication, you have the option of taking a second dose. When used as directed, Plan B one-step is safe and effective. Plan B one-step contains levonorgestrel, which is the same medication contained in many birth control pills. While taking Plan B one-step, you may experience headaches, nausea, breast soreness, dizziness, and abdominal pain. Plan B one-step should not be taken if you're already pregnant or breastfeeding. It should not be taken as a regular birth control method because it is not effective. Plan B one-step does not protect against HIV, AIDS, or any other sexually transmitted diseases.